Welcome back to part 2. Before the break, we were discussing the ways you can make cosmetic changes to your appearance as you age. And some people will go even further than that. And in one of our programs a couple of weeks ago, we showed a clinic in Switzerland where they offer rejuvenation therapy by injecting patients with sheep fetus. They claim to revitalize people's cells, and in so doing improve their general health, their mental agility, and even their sex lives. Apparently, the therapy helps to build up a patient's aging immune system, and hence strengthen their defenses against disease. It doesn't necessarily increase a person's lifespan, but perhaps it improves their quality of life.
I'm very suspicious of any treatment which is really stressing the importance of prolonging life. None of the diseases and disabilities that afflict old people, the real problems that face people today, actually only afflict old people. We've already heard about one person today who had osteoporosis from the age of 35 onwards. Cataract forms very early in some people. Dementia can form very early in some people. So we are dealing here not with, if you like, the natural aging process, but age-related disease, and it should be treated as such. We shouldn't actually allow people to think that because they are old, they are going to be ill or sick. Yes. And we need to do much more in the way of research and treatment, yes, and change people's attitudes about what they should expect.
Well, I know two things that are real facts in life, and that is, one, you're born, and two, you die. And that the body gets older and eventually it dies. If you put your faith in the body and that's all you have in life, then I'm very sorry, but you're in for a very hard time and not very happy experience. Before you have your collagen injections, yes, before you inject yourself with bits of dead lambs, before you go and have the scalpel, do the natural things first. Then if you still need to do the other things, fine. It's fine by me.
Yes.
Go and do them. But do the other things first.
I want to come back to you, Professor Barnard, because you said what to me seems quite an extraordinary statement in a way, that you think age is a disease.
Of course it is. I mean, a disease is, we define a disease by a process that causes pathological changes in the body, and as a result of these changes there are a deterioration in the quality of life. And that's exactly what aging does. You see, to think of aging just as appearance is a wrong thing. There are many other changes of aging. There's a decrease in the ability of the cardiovascular system, of the lungs, the nervous system, the muscular system, the brain, everything deteriorates. So what's very important is that with aging there is a decrease in the immune ability of the patient. Therefore, he will suffer from diseases where if he had an active immune system, he would not suffer from them. And we have shown in our research that these injections of this extract that we make really helps, there's evidence that it will help against cancer. We've shown in tissue culture and in animal experimentation that it has two effects. It attacks the cancer cell directly and kills the cancer cell. And secondly, it sensitizes the immune system to attack the cancer cell. So there's more to aging than just a feeling of being old or appearance of being old. There are vital and important changes in vital organs as a result of aging.
I think in all fairness, I must come back to Elizabeth Mills because I cut her off earlier. Would you like to finish what you were saying?
No,
Nellie?
I think it's very interesting what Professor Barnard is saying. I don't think it is right to claim that age is a disease, and that in itself is misleading. There are too many examples in this room alone of healthy, active old age. What I would like to see is people accepting the fact that disease is not an inevitable part of the aging process, and to actually tackle the diseases that affect older people with a rather more positive attitude than they currently are doing, so that more people can be in a room like this.
Yes.
I rather resent the idea that Professor Barnard is putting forward, that I'm diseased. If I'm diseased, I'm enjoying life. I dance 3 times a week. I sing. I go out every day of my life. I mix with people as my own age who are doing all the same kind of things. It's personality partly that overcomes all the difficulties. And if we cultivate a positive personality, as we age, we don't accept the attitude of society that because you age, you're going to get past it. Cultivate a positive personality. It is important as the things you're doing cosmetically. I know people that have had their faces lifted and a whole lot of things done. They don't enjoy life half as much as I do, and I've still got all the wrinkles.
Well, that's a very positive statement. But advances in medical technology has meant that we can now prolong people's lives compared with 25 years ago. Whether one can retard or improve the aging process, there are still countless conditions and diseases that, once diagnosed, are too much to handle for many people. And in recent years, there's been a growing interest in voluntary euthanasia. Now, I'd like to come first of all to Jean Davis. You are the chairperson of the British Voluntary Euthanasia Society, am I right?
That's right. I'm also the president of the World Federation of Right to Die Societies.
Well, could you tell us then, what are the main arguments in favour of voluntary euthanasia?
Chief one is the right of the individual to make their own decision, that if they are incurably ill and they have reached the point where they judge that their quality of life is not acceptable anymore, they should be able to ask their doctor for medical help to die, and provided that doctor follows the guidelines that have been very carefully laid down, this should be legal. It should be allowed.
The guidelines laid down in this country, as it were, by your society?
No, we would be happy to use the ones that are used in Holland. They've been worked out there between the Dutch, the equivalent of the BMA, but in Holland, and the courts together.
Well, we'll come on to those guidelines a bit later. I want to now put the other side of the argument and ask Dr. Stephen Kirkham, could you put the argument against voluntary euthanasia for us?
I'm not convinced that the onus is really on producing an argument against euthanasia, because actually the process of killing people, killing other human beings, is against every major moral code that there has ever been. Having said that, I think that there are certain arguments that we could pick up. Firstly, I think that if you say that there is a right to die, that implies that there is a right not to die, which I think is not so. As was said earlier in the programme, we're all born and we all die. So that to say that there is a right to die is probably a misuse of the word right. I think that people are free to end their lives when they choose, but in this country, if there is a right in law, that necessarily implies a duty in law. And there is not, in this country, a duty to take somebody's life. I think that voluntary euthanasia is seen as a route to avoid suffering, and it seems to me an extraordinarily blunt instrument to remove suffering.
There is no duty on the doctor, it's a matter of choice.
Yes.
There is no right for the patient, it's just choice. They have the right to ask, and the doctor has the right to give or to refuse.
Anybody else? Yes.
I've just finished 12 years working as a nurse, and the bulk of that time was spent working in terminal wards. And the horrors that I had to deal with. There was nothing wrong with the care. It was a perfect way of keeping alive relics of humanity. They were cared for, they were fed, but they were remnants. The suffering that I saw and that I had to tend, and the suffering that I saw of the relatives who came, caring relatives who would say, please let him die, please let him die. And there was one expression that I heard from nurse after nurse after nurse, which was this: please God, let me not end up here. Let me not end up here. And when you've tended these hopeless, pathetic remains, lying in a bed, skin broken down, untreatable ulcers, and you're giving them antibiotics to preserve their life, you're giving them appetite stimulants, you're giving them enhanced diets. And eventually we say it was a merciful release. Well, if it was a merciful release, why couldn't it happen sooner?
Yes.
And if we kept our pets alive the way we keep our old people alive, we would be prosecuted.
Yes, well, it's a very strong argument, I must say. Would you like to add to that?
I was with my mother a lot before she died. She couldn't remember anything more than a minute ago. She had no continuity of life at all. And she would say to me so often, why can't I go? Why do I have to stay? I don't want to be that in my children and my grandchildren's memory. I want to be me.
Yes, I think a lot of people do feel that. In all fairness, I must go now towards the aunties, as you might say. I'd like to ask you what you feel about it, Alison, isn't it?
That's right. I think one of the main dangers of voluntary euthanasia is that unless we allow it for everyone who expresses a wish to die, unless we allow it whether the person is physically fit or not, it ultimately becomes the doctor's decision whether or not that particular person is right to want to die. Already in this country we have instances of involuntary euthanasia. 2 weeks ago, in the case of a severely handicapped baby, the High Court judges decided that the baby should not deliberately be given life-saving treatment. This baby is aged 1 year and obviously is not in a position to express his opinion one way or the other. The fact is that doctors are making the decisions that lives like mine are not worth living. I was born with spina bifida, and babies with my condition are very often what's called allowed to die. It means they're sedated and starved to death. My point is that the pain that people suffer can be controlled. We can kill the pain without killing the patient. When we're talking about somebody who is suicidal, the issue in question is their mental agony more than their physical agony. And I would suggest that the mental agony of somebody like me who wants to die is no different from the mental agony of somebody perfectly fit and healthy who wants to die. We can treat the depression. We shouldn't kill the patient.
Thank you very much. Yes.
Well, first I must start by saying I'm a practicing Buddhist.
Yes.
And the
life is sacred.
idea that one should take one's life or the life of another is pretty repulsive to me. And the reason is this, that I believe in a principle. I belong to Nichiren Shoshu's school. And the principle is that oneself and the environment, there's a oneness between oneself and the environment. So in killing yourself, you are in fact affecting adversely your environment. And I think this is wrong. That's very briefly put, and there's a lot more to it than that.
Yes.
But I think it's wrong because one hasn't got the right to say, I'm going to kill myself, and believe that there's no connection between oneself and other people.
Well, from that, I'd like to lead on to the moral implications and the moral problems of this whole subject. Now, Luke Gormley, would you like to tell us what your feelings on that subject are?
Well, I'd like to make two kinds of points. One about the fundamental wrongness, as it seems to me, of voluntary euthanasia. Jean Davies says the justification is the self-determination of the patient. Now, it seems obvious to me that it can't be just the fact of the request to the doctor which justifies him in killing the patient. After all, even doctors in favour of euthanasia would say in certain circumstances, sorry, I'm not willing to do it because you simply have a wrong view of your prognosis. So it must be, because the doctor is a responsible agent, his view of the condition of the patient which justifies. And fundamentally, the underlying view, that which bears the burden of justifying voluntary euthanasia, is the doctor's judgment that the patient no longer has a worthwhile life. And it seems to me that if we legalize the killing of people on the grounds that they no longer have worthwhile lives, we will have passed into a situation, as indeed I believe they have already done so in Holland, where you cannot contain that. And in fact, you are moving into the execution of non-voluntary euthanasia. That's the logic of your position.
Yes.
That's the underlying logic of your position. Because the justifying judgment is the judgment that the patient no longer has a worthwhile life.
Well, this brings us on to the question that the position that doctors are put into. And I'd like to ask the doctors here.
That's completely wrong.
Yeah.
I mean, the patient agrees with it. It's not against the patient's will. The patients decide that the quality of life is not worthwhile anymore, not the doctor.
Yes.
The doctor is not the mere instrument of the patient. The doctor has got to make an independent judgment. And what justifies the doctor? He is answerable in law. What is going to justify the doctor is precisely his view that the patient has not got a worthwhile life.
Well, everybody wants to come in on this one. I do just want to, if I may, ask any doctors here the really fundamental question: would they be willing to assist anybody towards a voluntary euthanasia death? It's a very, yes, Dr. Lockie.
I thought this was a very good film. I thought it was very well made, and I was very interested in the doctor's viewpoint. I think there's two situations there. Normally what I'm saying is they have this card that says, I want to die if I'm not in a position to enjoy life. I would never put someone to death deliberately if they were unable to ask me to do so, because they might have changed their mind from being healthy to being diseased. Right? Secondly, in that film, in that situation, I don't see why the doctor had to be involved at all. All he could have done was set up the drip, put the heroin cocaine mixture, the lethal mixture, into a separate drip, given the patient a switch, and said, there you are, it's up to you. And that's morally no different from a patient going into a chemist buying a load of aspirin, or going into a gunsmith
but I
and
just
buying
want
a
to
shotgun.
ask you really the nitty-gritty question: would you assist someone or not?
I'm not going to tell you.
You're not going to say, no. Who would? Anthony, just a moment, I'll come back to you. I'm sorry, Jean.
Yes, I would, actually.
You
yes.
would?
Yes, because people reach a stage where they can't live any longer, and they are entitled.
Yes.
You're entitled to say yes or no in your life, surely. You're entitled to choose a car. You're
There's
entitled
someone
to
coming out with an unequivocal answer. Jean Davis, I must let you just quickly, last word.
Well, this allegation that involuntary euthanasia takes place in Holland, there's no proof of this whatsoever. It would be murder and the people would be prosecuted.
Yes.
It's just pure... It's just a smear, that's
well,
all.
We're going to move on to the whole question of Holland in a moment, because in our program last week on euthanasia, we showed a hospital in Amsterdam who have an unofficial agreement with the Dutch Justice Department. The doctors are allowed to administer voluntary euthanasia if the patient has a real desire to die, if there is no medical solution, if they can prove there is a real case for voluntary euthanasia, and if a second medical opinion is sought. Jeannie Wright, you wanted to come in on this, I believe.
Yes, I mean, I think it's important to say euthanasia is illegal in Holland. The majority of cases of so-called voluntary euthanasia are not reported to the coroner. I think the programme was misleading there. And even in this country, I'm sure that involuntary euthanasia is occurring. And a lot of people in the audience seem to be advocating involuntary euthanasia rather than voluntary euthanasia.
Oh, I don't think so.
Well, I think the gentleman over there was distressed at the distress caused to relatives by mentally frail people who are suffering. Now, who's suffering we're trying to relieve? The people who are ill and unable to make that decision, or the distress of the relatives. And certainly the Holland experience has suggested that the majority of people in Holland would be in favour of involuntary euthanasia. And the majority of residents of old people's home in Holland are afraid of involuntary euthanasia.
Can I just...
Getting this information from an American Journal of Medicine, which has published a retraction of the whole lot. It's a Hastings Centre report that came out last year.
Dr. Lockie, can I ask you, do you think that those procedures in Holland, those legal procedures, are workable? The conditions they suggest, or in fact lay down?
I think they're workable. I think we're dealing with a situation that has no ultimate answer, because no one here has gone there and come back again to tell what happens when we die. So I think it's completely hypothetical. It's got to be a moral judgment or a legal judgment to protect doctors if that's the situation that the public want. I personally would have I think they could work, but I think if in a situation where you've got a conscious patient that's capable of moving a hand, they should be allowed to commit suicide any more or any less than any other person in society is allowed to commit suicide. The same law can govern that. It's just the doctor or someone, or it could be a pharmacist even, is providing the means by which they can terminate their own life. And I don't think doctors have to get involved in that. And I don't therefore see why one needs to set up that kind of procedure.
Well, obviously this is a subject that everyone feels very passionately about. It's an enormous subject, as we were saying before. But may I thank you all very much for participating, and may I thank the people at home for watching. I'll be back early next year for another studio discussion. Over the next few weeks, the Third Wave series will be turning its attention abroad to other cultures to examine their attitudes to aging and the older generations of their societies. We're kicking off next week with a program about retirement in Spain. So thank you once again. See you in a few months. Goodbye.
Thank you.